So after we treat bacteria, parasites, or viruses that stem from tick-borne infection, it's important to get rid of inflammatory chemicals that are floating around the body. And sometimes we can use things like cholestyramine or Welchol, which are toxin binders that are just the right molecular weight to grab onto those and put them out through your stool. They don't absorb through the liver. They don't go into your circulatory system. They just grab stuff out of the gut and get rid of it. And some people don't do that very well on their own, so they need these added things. Depending on what it is, sometimes you can also use things like charcoal and chlorella and bentonite clay and chitosan and that kind of thing. It's also important to not put more inflammatory chemicals in your body as you're doing this detox type thing. Having clean air and clean water and a clean environment is very important. After we get rid of toxins, you can restore the system with things like fish oil, IV treatments of NAD and ozone to get your mitochondria back online, because there's a lot of cell damage that happens during infection, and so your mitochondria become less efficient at making energy, which is what their main purpose is. And NAD gets very depleted by chronic inflammation, and NAD is very important for mitochondria as well to make energy. It also helps people, it's an added way to detox. It helps them with brain function and just the fatigue that can linger for so long after an infection. So those are the kinds of things we do. Sometimes hormone support, depending on what's happening, because that hypothalamus pituitary axis gets offline. It's lots of things that kind of get your computer rebooted.